Welcome to this educational video about central serous chorioretinopathy, often abbreviated as CSC. This eye condition, while not usually blinding, can cause significant visual distortion and worry for those affected. We'll explore the causes, symptoms, diagnosis, and treatment options available. Join us as we delve into the world of CSC. The exact cause of CSC remains a mystery, but we have some strong clues. It's believed to be linked to elevated levels of cortisol, a stress hormone. This connection is supported by the fact that CSC is more common in people under stress, with type A personalities, or those taking corticosteroids, whether in pill, cream, or even nasal spray form. Other potential associations include pregnancy, hypertension, and even certain medications. However, it's important to remember that in many cases, no single, identifiable cause can be pinpointed. To understand CSC, we need to understand what's happening inside the eye. Behind the retina, which is the light-sensitive tissue at the back of your eye, lies the choroid. The choroid is a layer of blood vessels that nourishes the retina. In CSC, the choroid becomes leaky and allows fluid to seep through the retinal pigment epithelium, or RPE, which acts as a barrier. This fluid accumulates beneath the retina, causing it to detach, particularly in the central area known as the macula. This detachment blurs and distorts vision. CSC predominantly affects middle-aged adults, typically between the ages of 30 and 50. Men are more likely to develop the condition than women. While CSC can occur in all ethnicities, some studies suggest a higher prevalence in certain populations. It's considered relatively uncommon in children and older adults. It's worth noting that while rare, CSC can affect both eyes simultaneously, though it's more common for it to affect just one. The symptoms of CSC can vary, but some of the most common include blurred or distorted central vision. Straight lines may appear bent or wavy, a condition called metamorphopsia. Colors may appear faded or dull. Many individuals also experience a central blind spot, known as a scotoma. Objects may appear smaller than they actually are, a phenomenon called micropsia. Sometimes, people describe a feeling of haziness or shimmering in their vision. It's essential to consult an eye doctor if you experience any of these symptoms. Diagnosing CSC typically involves a comprehensive eye exam. Your eye doctor will check your visual acuity and perform a dilated eye exam to examine the retina and choroid. Optical coherence tomography, or OCT, is a crucial imaging technique that provides detailed cross-sectional images of the retina, allowing the doctor to visualize fluid accumulation under the retina. Fluorescein angiography, another imaging test, involves injecting a dye into your bloodstream and taking pictures of the blood vessels in the retina and choroid. This test can help identify leakage points that are characteristic of CSC. CSC can be broadly classified into acute and chronic forms. Acute CSC is typically self-limiting, meaning it resolves on its own within a few months. Chronic CSC, on the other hand, persists for longer than 6 months and can lead to more permanent vision changes. There are also variations in the leakage patterns seen on fluorescein angiography, which can help guide treatment decisions. Your doctor will determine the specific type of CSC based on your individual presentation and diagnostic findings. In many cases of acute CSC, observation is the initial approach. Since the condition often resolves spontaneously, your doctor may recommend monitoring your vision and waiting to see if the fluid disappears on its own. If the fluid persists or if your vision is significantly affected, treatment options may be considered. These can include laser photocoagulation, which uses a laser to seal the leakage points in the choroid. Another option is photodynamic therapy, or PDT, which involves injecting a light-sensitive drug into your bloodstream and then applying a low-intensity laser to the affected area. Anti-VEGF injections, which are medications that block the growth of new blood vessels, are sometimes used, although their role in CSC is still being investigated. Lifestyle modifications such as stress management and avoiding corticosteroids are also important. Currently, there are no definitive ways to prevent CSC. However, managing stress levels through exercise, mindfulness, and other relaxation techniques may be beneficial. If you are taking corticosteroids, discuss with your doctor whether there are alternative medications you can use. Regular eye exams are also essential, especially if you have risk factors for CSC, such as a family history of the condition. The prognosis for CSC is generally good, especially for acute cases. Most people with acute CSC experience a full or near full recovery of their vision. However, some individuals may have residual visual distortions or decreased contrast sensitivity. Chronic CSC can lead to more permanent vision loss, including atrophy of the retinal pigment epithelium and the development of new blood vessels under the retina. Recent research is exploring new treatment options, such as micropulse laser therapy, which is a gentler form of laser treatment. Scientists are also investigating the role of genetic factors in CSC and developing new imaging techniques to better understand the disease process. continued research efforts hold promise for improving the diagnosis and management of this complex eye condition.